What's up, everybody, and welcome back to another exciting episode on the channel. Today we're going to talk about a medication that's on pretty much everybody's counter, at least a lot of us, and that is Lasix. Furosemide would be the generic name, and we're just going to talk about the basics of it. If we wanted to get in depth, it would take probably a good hour or two to go through absolutely everything there is about it. So as always, with the disclaimer on here, if you feel like you're having a medical emergency, please stop watching the video and call 911 or have somebody drive you to the nearest emergency room immediately. Don't be watching this to help try to figure something out that is potentially life-threatening. This video is for educational purposes only. It's not intended to diagnose, treat, or cure you. And please only use this video to help formulate questions to ask your doctor and or your care team. Do not use information in this video without consent from your doctor or your care team. If you do, the responsibility will fall solely on you and not myself, the maker of this video. We want you to work with your care team, not make your own medical decisions. As either myself or you are probably not a doctor. I know I'm not, and I'm assuming you're probably not. If you are, then, do with it as you will. And the information that I do get for this video is what I consider from a reliable source and is known to be accurate at the time of recording, but can change in the future. And I won't necessarily update the video unless it's major changes, something that would truly need to be changed to make sure you can ask the right questions to your doctor or care team. So what is Lasix, or the generic furosemide, which is probably what's on your bottle because most people do get the generic form of it. Lasix is a loop diuretic that prevents your body from retaining too much salt. So essentially, it'll help take out any excess salt from your bloodstream through your kidneys. A simple way to remember how this works is the salt's removed, water always follows salt. Your body wants to balance out. Water will go from the kind of less soluble substances like the salt to more of them to kind of balance it out. So when the Lasix removes the salt through your kidneys, the water comes with it. And that's kind of how it helps clear excess water from your body. And diuretics, they're often referred to as water pills. A lot of people will call them that. So if you hear somebody talk about water pills, that's essentially they're talking about diuretics. Indications or reasons you would use Lasix. Lasix is mostly used to treat edema, which is swelling due to fluid retention. And the most common places to see this edema is in your lower legs, and that's because this is the furthest place from your heart. It's also below your heart, and gravity will pull extra water down. If you have less of a heart function, it's harder for it to push it back up through. It pushes less with each beat, therefore it's easier for it to pull down in your feet and your legs, and that's what will swell. So this commonly happens in congestive heart failure, also liver disease or kidney disorders such as nephrotic syndrome. It can be given for either acute edema, which is where you may have a lot of swelling within a day or two, or it can be used as a preventative measure. You may be on it daily or kind of an as-needed basis, maybe a couple times a week, whatever your doctor prescribes. The most common route for delivery would be the oral form, which you take at home, and there's the IV form, which is usually given in hospitals, and this is for a kind of a quicker reduction of edema, pulls out more fluids. But it can also be used to treat for hypertension. Some people will have extra fluid in their circulatory system. This can cause higher blood pressure. Sometimes doctors will use that as well. And remember, the fluid, just so if you didn't know, it pulls it from your circulatory system. So in order to pull that edema away, it has to take it out of your circulatory system. This will give you less fluid circulating throughout your body and will help that fluid that's in your legs, in your stomach, or wherever else that you're swollen. It'll seep back into your circulatory system, and that's what brings down the edema or the swelling. This doesn't actually pull the fluid from your legs or stomach or wherever. It actually pulls it from your blood, and that's where it creates the extra space for that water to come back into your blood, and you can also eliminate that through going to the bathroom. So just so you know, that's how that works. Some reasons why you would not take Lasix. Those unable to produce urine. Of course, if you can't produce urine, if you have extremely poor or no kidney function, a diuretic's not going to do anything for you. If anything, it's going to overdose you on that, which is not a good thing. And like everybody says, if you're hypersensitive or allergic to an ingredient, obviously you won't take it for an allergy. So precautions before taking Lasix, these are things that you need to talk to your doctor about. And of course, it makes it sound like when I always think when they say that, it's like your doctor should know these things, but if you're going to a cardiologist, they probably don't know everything necessarily that you're talking to about your family doctor unless they're really good at sharing records. But you want to talk about your personal or family history of any blood clots, embolisms. The Lasix, it can cause dehydration. This can cause vascular collapse. It also reduces the amount of fluids in your bloodstream. Therefore, you're going to have a greater amount of platelets, blood cells in relation to the amount of fluid in your circulatory system, and this can increase your risk for forming blood clots. If you have issues with electrolyte imbalances, because again, when you take fluid out, you increase the electrolytes. Sometimes it can eliminate electrolytes. So that's something that if you have issues with that, you want to talk to your doctor about. Any urinary retention issues, just guys with enlarged prostates, stuff like that. If you're having trouble peeing and this is filling your bladder up, you don't want to have any issues trying to get rid of that because that can cause more damage. If you have allergy to sulfonamides, there is a chance you could be allergic to Lasix, so just let your doctors know that. And there's other which I have not listed, so just talk to your doctor, ask them questions about things that if you've had in the past, some things that maybe they can ask you yes or no if you have had them, just to make sure this medication's safe for you. So a very basic history of Lasix. It was discovered by Carl Strom and his team. Some sources have said it was discovered in 1959. The most reliable ones that I found, or ones that I would consider most reliable, said 1962. So I'm kind of going in that time frame, but somewhere in that time. And then also, just a little side piece of information is that Lasix was placed on the WHO's or World Health Organization's list of essential medications, which are medications they consider most important to a basic healthcare system. And just a personal opinion, I've looked at this list. There's a fair amount of drugs on there, and all of them make sense to be on there. I think these should be free. If these are basic necessities for a healthcare system, I think they're basic necessities for all of us to have a good quality of life and good quality of healthcare. But that's just a personal opinion, and obviously it's never going to happen. Some side effects of Lasix, things to look out for when you do take it. Hypovolemia, which is low volume, like I talked about before with blood clots. This is essentially you're dehydrating yourself. Not necessarily to a dangerous level, but it does cause initial dehydration before your body can reabsorb fluids that have gone into your legs, stomach, other places. You can get hypotension or the low blood pressure, especially orthostatic, which is a sudden drop in blood pressure when you stand up. This will cause dizziness, sometimes little blackout spells, and definitely increases your risk of falling. So when you start taking this, until you get used to it, you definitely want to stand up slowly. Take your time, make sure that you got something you can hold on to just in case. It can also give you hypokalemia, which is low potassium, hypomagnesium, I probably said that wrong, but low magnesium. So you want to look out for those things. There are specific symptoms on there. I didn't list them. Just talk to your doctor about it. And then a big one, especially with IV Lasix, is ototoxicity, which is hearing or balance issues due to the medication. A lot of times this will start with ringing in the ears. It can lead to hearing loss. If it's caught early, I believe it can be treated and reversed. I found that it could be treated, which I'm assuming means it can be reversed. It mostly happens due to rapid administration of IV or overdose of medication. So if you're in the hospital and you're getting IV Lasix, if your nurse is giving to you, make sure they're just not slamming it in through your IV. It is supposed to be given over at least a minute or two. So that's something just to be aware of if you're in there. And we're going to go over some strengths. We'll start with the oral dose because most of us will be taking it at home, and that's kind of the big one for most of us. So the initial dose, generally you'll start between 20 and 80 milligrams. You can have a second dose of the same amount or increase by 20 to 40 milligrams no sooner than 6 to 8 hours after the first dose. And this is to reach your diuretic effect. So let's say you start on 40 milligrams, it really doesn't do much for you. As long as your doctor says so, you may do another 40, or you might do 60 to 80 the next dose to see if that helps you lose a little bit more fluid. Then the maintenance dose, you're going to go with the dose that provides that desired diuretic effect, and you're going to have it once or twice a day, and they have to be at least 6 hours apart. So, something like 8 o'clock in the morning, 2 o'clock in the afternoon. The max dose is up to 600 milligrams a day. So if needed, you could potentially take a lot of it. Most people don't take that much, but that is an option. With the oral dose, it does take about an hour to an hour and a half after the first dose is administered for it to take effect. It peaks around 2 hours, so you should know in the 1 to 2, 3 hours after taking it, just make sure you have a bathroom nearby or one that's accessible. And the effects generally last 6 hours, but can last up to 8 hours. And the titration of the dose, where you may take the second dose, you may take more. That's something you want to talk to your doctor about, because a lot of times they'll give you a dose, have you try it for a couple days, a week or two, see how it works for you, and then they may alter it from there. So don't just give yourself more because I told you that is a way you can figure out your desired dose. Talk to your doctor about that. That's totally up to them. If they say take this dose this many times a day, that's what you should take unless they change it. And for IV, generally IV is used for acute edema or an exacerbation of congestive heart failure requiring hospitalization. So generally they'll give you 20 to 40 milligrams over a slow IV push, like I said, 1 to 2 minutes. You don't want to have them just slam it into your IV, and that's not good for your ears. And it won't make it work any better or faster. So, just make sure that they're doing it kind of slow. Sometimes the nurses, if they get in a rush, they may do that, but stand up for yourself and let them know it's supposed to go over 1 to 2 minutes. And you can repeat the same dose or increase it, and they're going to do that based on what the doctor says. And it has to be at least 2 hours apart, and they're going to do that until you lose as much fluid as you need to. And the maintenance dose after that, it's going to obviously be up to the doctor, and you're going to get it once or twice a day. And another thing, especially if you're in the hospital, they're probably going to have some kind of they're going to want to take account and measure how much you have of fluid out. So they're probably going to have you use something to catch your urine when you go, because they're going to want to know how much you're going to make sure that the medication's working for you. But for the IV medication, it does start working in as little as 5 minutes, since it's going straight into your veins. The peak onset is going to be about a half hour in, and then within 2 hours, it should have pretty much run its course, and hopefully you'll go back to a normal bathroom schedule. One thing you probably want to do when you're on Lasix is take a daily weight. And this is just going to monitor fluid retention, how much weight you've lost due to fluid expulsion from your body. So this is something people with congestive heart failure should be doing on a daily basis anyway, just because we do want to make sure we're not holding on to fluid. And your doctor, you can talk to them. They'll let you know how much you want to gain weight or lose weight before you talk to them. But you want to weigh yourself when you first wake up in the morning. This is after using the bathroom and not having anything to eat or drink yet. That way, your bladder's empty, your stomach's empty, you know your true weight, or as close to the true weight as you can get. And you want to wear the same clothes or type of clothes when doing it. Best to do it naked, but I know that may be weird for some people. But if not, just your general underwear, something that weighs about the same. That's the best way to do it. And you want to keep a log of it, especially if you do have issues with fluid retention. If you don't, you can just kind of make mental notes. You should know about where you're at each day. And then, if you need to, you can talk to your doctor about it. So what do you do if it stops working for you? Over time, diuretics can stop having their desired effect. This happens. Sometimes it doesn't. But if there is, you probably won't know why. I don't think your doctor will specifically know why. I'm sure they can make guesses, but there's a lot of reasons. So the reason why isn't as big of a deal as being able to recognize it and getting those changes so that you can get something that does work. But when you do realize it stops working, let your doctor know. Don't wait for your next appointment. Let them know that day. Give them a call. Talk to their nurse. They could either, they could either try increasing the dose or potentially change to a different diuretic that works with a different mechanism or different part of the kidney. So don't be afraid to talk to them about that. Questions you may want to ask your doctor if Lasix is a good choice for you and part of your treatment plan. Never hurts to ask. I've asked about medications and they've decided to try them for me and they have worked, which, you don't know if you don't ask. When should you take it for the best results? Do you want to take it in the morning, afternoon? When would be the best? What symptoms should you look for if it's taking off too much fluid? Because sometimes these things work really well for people. So you do want to know, is it working too well? And what will I have happen to me to know? And what should I call you for? What effect or symptoms should I notify you for? It's always good to know if I'm having XYZ happening, this is when I need to call you. And then you want to know, should you initially titrate the dose to see which dose works best for you, or if they want you to stay on the same dose for a certain amount of time, monitor your weight, monitor how much you go to the bathroom compared to before you took it. Just have that conversation with them. And they're going to be more than happy to let you know what they think is best for you and best for them to help monitor you and do what's best for you. Then you want to know your maximum daily weight gain or your weight loss before you contact them, because it may not be working well. You could still be gaining weight, gaining that fluid weight, or it could be working too well and you could be dehydrating yourself. And when you dehydrate yourself, you can also put your kidneys at risk for some injury. So just ask them about that when you should contact them. And if you need any periodic testing or labs while taking the medications, and this could be especially for people that have issues with electrolytes, stuff like that. So just ask them about that. It's, even if you think it may sound silly, it's good things to know, and it might trigger something in them to say, hey, yeah, we should probably do that. So just make sure you ask them all the questions you think you need to. Don't be afraid to ask. That's what they're there for. And to wrap it up, there's so much more in this medication that I can't cover in an efficient amount of time. If there is anything else you want to know about it, or a different area aspect of it that I didn't hit on, just leave a comment in the video. I'll be happy to do a follow-up to this video. I'm talking about some different things that I did not cover this time. And if you are on this medication, be sure to familiarize yourself with it beyond what I've covered, and make sure you use reputable sources, or you can ask your pharmacist, your doctor. And this is with any medication. You want to know as much as you can about it. It's really important to know your medications. And with that being said, you know how YouTube works. If you like this content, definitely subscribe. Turn on notifications. It'll let you know when I post more videos. Commenting, liking the video. This actually helps with the YouTube algorithm, helps people find the video. So if you found it helpful, just give it a like. Then hopefully when other people search about Lasix or heart failure, they'll find this video. They'll be able to watch this and the other videos on the channel and get themselves up to date with some useful and accurate information on these medications and this condition. So I appreciate y'all watching it to the end. And until next time, take care of yourselves and you have a good day.